now take a short break and enjoy a special video segment called The Little Ladybug, which was created by one of the friends of the Rotary Club of World Disability Advocacy, Toon Sanders. He uses animations and creative media for educational advocacy and humanitarian outreach through the Hope and Dishi Academy. This is a charming, short 3D animated film that explores the classic childhood themes of natural curiosity, consequences, and doing the right thing, and serves as an engaging way for children to learn important life lessons about obedience, responsibility, and making good choices. Please enjoy this video, and you can find many of his other amazing videos on YouTube.
Hello, little nature lovers. Do you know how maize grows, big and tall? With sunshine, rain, and some tiny helpers too. These little heroes keep the plants nice and clean. Meet the ladybird, and let's enjoy the song together.
A little red ladybird lived on a leaf. He lost one small leg, oh that was a grief. But the ladybird said, I will try my best. I may be different, but I'm like the rest. With 5 little legs, he walked very slow, up green leafy plants where the farmers grow. He saw tiny aphids, black and green. Munch, 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 I'll keep plants clean. In Africa, where the sunshine is bright, he helped the crops grow strong and right. The farmers smiled and said with cheer, this little helper is welcome here. So children, remember, big and small, different does not mean weak at all. You can help others, yes you can. Just do your best, that's the plan.
I hope you've enjoyed that short video. I was hoping it would be longer, but it's been very educative. I love ladybugs. Explains why I love polka dots. After this short break, we move on to our second panel discussion, and I welcome everybody back. Our next session will remind us that truly inclusive healthcare cannot be designed for neurodiverse individuals without their active participation and leadership. Lived experiences, expertise, and healthcare systems become stronger when diverse voices help shape every decision. Moderating this discussion is Caudence Ayoti from Tanzania. She is a distinguished social entrepreneur, tourism expert, and a passionate advocate for inclusive education. She's the co-founder and CEO of Dyslexia Tanzania, an organization dedicated to breaking stigma and creating equal learning opportunities for neurodivergent children across the country. With more than 2 decades of experience in the tourism industry, she's also the founder and CEO of Demi Tours and Travel Africa, using impact tourism as a vehicle for community development and social change. A champion for women's economic empowerment, Caudence continues to mentor and inspire emerging African leaders. Please join me in warmly welcoming Caudence Ayoti, who will introduce the panelists as we explore redesigning healthcare, centering neurodiverse voices in every decision. Welcome, Caudence.
So this evening, we are going to have quite a dynamic panel of two panelists. And I would like to just mention their names. They're going to come and introduce themselves in detail. The first one is Amy Bodkin from the USA. And Amy is an autistic consultant. Amy, you're welcome. I would like you to come on board and introduce yourself more.
Thank you very much. I am autistic, ADHD, I have Ehlers-Danlos, I have POTS, I have mast cell, I have dyslexia, auditory processing disorder. I have a lot of letters after my name that I did not earn in school. And both of my children also have Ehlers-Danlos, which is a connective tissue disease. And we've spent a lot of time navigating the healthcare system. So this is a topic that is near and dear to my heart.
Thank you so much, Amy. You've been amazing. And just to say that we've worked together with Amy. She does sessions on my dyslexia online school. And it's a pleasure to work on this project together, Amy. Thank you for your time and for accepting to be part of this inclusion discussion.
So
I'm going to welcome Wycklife all the way from Nairobi. Wycklife Owino is the Executive Director of NeuroBloom, Kenya, and he's a clinical officer. Wycklife, would you like to tell us more about yourself?
Yeah, thank you so much. Good day and good evening, good morning, everyone. It is an honor. This is a genuine privilege to join you from Kenya and to be part of this important global conversation. To the organizers and to the Rotary, to the advocates, healthcare and researchers, and everyone and all the neurodivergent individuals joining us today, I want to say thank you for making space for this conversation. As you've been told, my name is Wycklife Owino. I'm a clinical officer by profession, and I'm also a writer by passion and a grassroots advocate for calling. So yes, as you've been told, I'm the executive director of NeuroBloom Kenya. I founded NeuroBloom Kenya because I became convinced that healthcare should do more than conditions, and it should recognize the humanity of every person it serves. And over the years, I've had the privilege of working alongside families and listening to their stories and also witnessing both the strengths and the struggles they have to go through as neurodivergent individuals while they're navigating healthcare systems that were often not designed with them in mind. So those experiences have shaped my belief that the future of healthcare is not only about better medicine as we speak. So it's also about better relationship and better understanding and ensuring that every person is seen, heard, and valued. So I'm grateful to share this conversation with all of you today. Back to you.
Thank you, Wycklife. And friends, I'm going to share a very personal experience. This year in April 2026, April, we had Dyslexia Tanzania. We organized a dyslexia awareness run in Dodoma. And during the promotion of this activity, we were in touch with a big referral hospital in Dodoma called Dodoma Referral Hospital. And we went there basically to seek support and ask them to provide us with an ambulance. And we told them we are doing a project that touches the community. It's about dyslexia. And amazingly, nobody knew about dyslexia, what it's all about. They called us for a workshop, and they put together all the doctors, and we had to speak about dyslexia, and they confessed that this thing is new. So when Rotary Club of World Disability Advocacy is organizing this kind of workshop, this kind of summit, talking about redesigning healthcare and centering neurodiverse voices in every decision. Imagine if medical professionals do not know about dyslexia. They do not know anything about it. How will a dyslexic person get help? How will an autistic person get help when they are sick? Because they also get sick just like anyone else. So this got me thinking about how much work we have to do to talk about how we should redesign healthcare systems to reflect, to involve neurodiverse voices so that they can actually get help when it's needed. So I'm going to read to you a small introduction, and it goes like this. Healthcare is fundamentally broken for those whose minds process the world differently. For decades, clinical systems have operated under a rigid medical model that treats neurodivergence such as autism, ADHD, and dyslexia as a problem to be cured or a behavior to be normalized. This panelistic approach creates staggering systemic barriers, turning routine medical care into an overwhelming, inaccessible minefield. True equity demands a radical paradigm shift. Redesigning healthcare requires moving past passive consultation and actively centering neurodiverse voices in every single decision. By honoring the lived experiences of neurodivergent individuals as the primary healthcare systems that bend to accommodate diverse minds, we transition healthcare from a place of forced compliance to a foundation of true human rights, accessibility, and dignity. So we are going to share an experience as a panel. And just to start us off, I'm going to ask our first question to Emmy. Emmy, could you kindly let us know what is neurodiversity and why are we talking about it at a health summit? At a health summit. Yes, Emmy, what is neurodiversity and why does it matter? Why are we talking about this at a health summit? Emmy, you're welcome.
Thank you. Neurodiversity, it basically means that your neurology seems to be different. My background is school psychology, and I had a specialty in neuropsychology. So those were things that I studied when I was in school. Our neurology develops over our lifespan. And when we are young, if something disrupts that development, then it's going to have an impact on what our neurology looks like. And so we see that a lot of times in what we call autism, ADHD, dyslexia. But the reality is that your brain is connected to the rest of your body. So if your brain develops differently than is expected, then there will be differences with your body, whether they are smaller differences or bigger differences. The majority of neurodiverse people have more health problems than the average person. And we have neurodiverse brains. Also, if somebody's not feeling well, they don't function well. Like, think of any time you've been sick and were you really performing at your best at that time? Probably not. And so a lot of times neurodiverse people will have health conditions, but they get ignored. I can think of a classic example from our own life. When my kids were little, they're both autistic. I took them to the doctor because something was wrong. Mom knew something was wrong. And the doctor said, they're just autistic. I wasn't happy with that. So I took them to a different doctor. And it turned out they had undiagnosed celiac disease. But because the doctor was looking at the fact that they were diagnosed with autism and that a lot of their behaviors could be chalked up to autism, he wasn't willing to consider that they might be hurting. And they were most certainly hurting, and their immune systems were not functioning properly because it had gone on for so long. We very often are not heard because our communication and behavior looks different from someone else's. And that is not an excuse not to listen to someone. We have to get better at communicating with each other. So that is a little bit about neurodiversity in healthcare. There are some significant comorbidities for neurodiversity with healthcare. Some of them I mentioned earlier that I also personally have. I have a connective tissue disease called Ehlers-Danlos. If you have Ehlers-Danlos, you are 640% more likely to be autistic. And yet we do not screen autistic children for Ehlers-Danlos. I don't think anywhere in the world. I haven't heard of anyone doing that. I also have POTS, which is hugely comorbid with autism because it is disruption of the autonomic nervous system, that part of your nervous system that regulates heart rate, breathing, all those things you don't have to think about. Well, mine doesn't always work. And sometimes I will find myself suddenly very ill because my body is not regulating my heart rate, blood pressure, breathing, all of those things correctly. Mast cells, another common comorbidity where you develop very unusual allergies and sensitivities. And then on top of that, you've also got the sensory processing differences that can go along with how we perceive things. So someone might say, no, that's hurting me. You're like, well, it can't possibly be hurting you. It hasn't hurt any of my other patients. Well, maybe their sensory processing is different and they are feeling it. So there are many, many, many different ways that neurodiversity is something we've got to be talking about when it comes to healthcare. One of the most recent studies that came out said that in 51 different categories of care, neurodivergent people received less care than the typical person in 50 categories. So we are not getting the same care that other people are getting. And it is a serious problem, primarily because there was another study that was done a while back on autism, and the study found that the average lifespan for someone who is autistic is 36 years old. You might be wondering why that is, because you're like, I know plenty of autistic people that aren't 36. They're older than that. And I'm older than that. But the average lifespan is based on adding all people's lifespans together and then dividing by the total number of people. And so we've got some kids who die very young due to accidental death or due to lack of caregiver support. And then we've got other people who are at higher risk of suicide when they are in their teen years due to bullying. And then we've also got a higher rate of people as adults, if they make it to adulthood, with higher rates of autoimmune conditions and other kinds of chronic health issues. So it's extremely relevant. And there was also research a while back that was looking at the impact of trauma and anxiety on healthcare. And they found that depending on what they called an ACE score, that the higher your number was, the more significant your health problems were going to be, regardless of how healthy of a life you lived, because anxiety and trauma has a huge impact on our biology. And anxiety and trauma is something that goes part and parcel with neurodivergence, because it is not easy living in a world where your senses are telling you one thing and everyone else's senses are telling them something different. When people aren't listening to you because they don't believe you. Those kinds of things can be very traumatic, especially if that not being believed part influences your quality of care. I had a doctor one time not believe me that I had severe allergic reactions to things, and I was concerned about contrast in an MRI. She prescribed me Valium for anxiety. When I finally went in to get that scan done, the radiologist said, I'm not doing this until you're on steroids, because I am not going to be responsible if you have a reaction. And so we canceled it and had to reschedule because the doctor did not give me steroids the first time around. She did not hear my concerns. And so obviously these kinds of things can cause serious problems when people aren't listening. And to listen, it's not enough to open up your ears and hear the words coming out of people's mouths. To listen, you have to really hear their experiences and be willing to consider that they may have a different perspective and they may have different knowledge from you. And to recognize that their knowledge is not necessarily wrong. So that is why we're talking about neurodivergent healthcare, because it has such a huge impact on our health outcomes. Our health outcomes are not good. All of those studies I mentioned just now prove that it is not good. It is not good enough. So.
Thank you so much, Amy.
Can I add just a summary, something small on the definition of neurodiversity? Now I understand it on the aspect of hospital and as a clinical officer. Imagine going to the hospital already frightened, and then only to discover that nobody actually believes what you're saying. Would you be back to that hospital? So it will be difficult. So in my thought from a healthcare perspective is that neurodiversity, it's not just about how people think or learn. But again, it also influences how people experience healthcare itself. For example, if someone is overwhelmed by sensory environments, then they communicate differently and has some difficulty expressing the pain they have. And that directly affects the diagnosis, the treatments, and even health outcomes. So that's why neurodiversity belongs at Health Summit today, in my own view. And it's about ensuring that healthcare works for every brain and not just the majority, where it was designed for neurotypical before, and the neurodiverse were not involved. So we are talking so that it involves everyone. That's what I wanted to add in the diagnosis, or rather the definition of neurodiversity.
Thank you, Wycklife. And thank you so much, Amy, as well, for sharing your personal experience. You can imagine what you went through. You're unwell, you're seeking help, and nobody understands you. Nobody is able to help you. And recently, I saw a post on social media that a place that should really humble you is a hospital. So you're going to a hospital when you need help and nobody's able to help you for whatever reason. So this brings us to the second question, and this goes to you, Wycklife. If healthcare systems are truly being redesigned around neurodiverse voices, how do we ensure that neurodivergent individuals are not only consulted symbolically, but are actually involved in decision-making, policy design, and leadership within healthcare systems? Welcome, Wycklife.
Thank you for that question. I think, and I believe the question asks something much bigger than who sits at the decision-making table. It asks whether we truly believe that neurodivergent people are experts in their own lives. And for me, for a long time, I believe healthcare has been built with good intentions. The intentions were good, generally. As I was explaining, that I believe the question you've asked me is that about who is making those decisions and is at the decision-making table. So, and we believe that neurodivergent people are experts on their own lives. So I wanted to say that for a long time, the healthcare has been built with good intentions. And quite often from the positions where professionals are, it held all the knowledges and the patients were expected simply to receive it, because the intentions were that when patients come into the hospital, they receive the best service, the best care. But the challenge is those who are making those models, neurodivergent people were never part of it. So they were the models which were made in the healthcare system did not fit the neurodivergent. So that model has achieved some remarkable things and a lot of remarkable things in other treatments, I believe. And we have a lot to celebrate the model, which was already there. So, but when it comes to neurodiversity, I think it has not achieved. It still has got some limitations, which we need to work on. So for in Kenya, I've learned that some of the most profound lessons about healthcare, they don't come from textbooks or lectures, right? And they have come from the sitting and the bedside. When you go to the hospitals, when you go to the bedside and listen to the patients, that is where you get the most profound lessons of how to treat a patient. So when you walk into that, when you sit with that patient, that is when you learn that this is how I should treat this patient. This is what this patient needs. And so spending more years on searching for answers for the neurodivergent actually is not going to give us a solution if we still search for those answers without bringing them in and listening to them in their bedside and involving them in making those decisions. So I believe when they have to come from listening to the individuals, whether it's autistic, then they describe what it feels like to enter the hospital, where every light seems painful bright to them, and every sound feels overwhelming, and every interactions leaves them feeling misunderstood. So I believe that is what we actually need to understand first before, and we involve them before we do any other thing. That's when policies and decision making will really help the autistic individuals.
Thank you. Thank you so much, Wycklife. Thank you so much. We need to involve these people. As much as they are not professionals in the health system, they have lived experiences. So as you say, we need to involve them. And I love the point you gave that all the big lessons are not learned from textbooks only. You also get them as you practice your career. As you meet different people with different challenges at the hospital, you also get to learn more. So this brings us to the second question for Amy. Amy is a parent, Amy is an autistic adult, and Amy is a consultant now. But I know in your life, you have learned quite a bit about health. So we are going we would like to hear from you, Amy. What are some of the things we have what are some of the things from experience you know about neurodiverse health? What are some of the things you know about neurodiverse health? Amy?
One of the biggest problems we have, honestly, is inflammation. Inflammation is a huge issue within neurodiverse communities. Some of that I honestly think, based on the research, is because of the high levels of anxiety that we often feel trying to navigate a world that wasn't designed for us. There was a great little clip on social media a while back that showed what the world would be like if the world was designed for wheelchair users, and how it might be scary for someone who walks on their legs to be trying to navigate city streets where wheelchair users are zooming around at breaknecking speeds. And I think that's a really good visual image for how anxiety provoking and difficult it can be to navigate life when your brain is different from the average person's. And that high amount of anxiety, when we go into fight or flight, it causes us to dump all of our vitamins, minerals, neurotransmitters, hormones, pretty much everything your body needs to function, or at least a healthy immune system, goes into the bloodstream because it's a red alert situation. And then when we're done, then whatever's left is urinated out. The problem is that if you do this over and over and over and over again, you're going to deplete the very things your immune system needs to function. And so we end up with a lot of people who have a lot of inflammation, partly due to the anxiety that we could address better by making sure we're communicating more clearly and providing more options, perhaps even considering universal design within healthcare. So that's one area of concern. Another area of concern is that we've been saying for a while that autism is genetic. And we now know that if you have a connective tissue disease called Ehlers-Danlos that is genetic, that you are 640% more likely to be autistic. You're also more likely to be ADHD. I just don't have numbers for that one. So the odds of you being neurodivergent are extreme. One of the most recent research studies that's come out within the last year out of the UK was done by Dr. Jessica Eccles, and she was talking about how they have found that the left amygdala in the brain is enlarged with people with Ehlers-Danlos, and that means that that's going to have an impact on emotional regulation as well as executive functioning, and a lot of those things that we already see in those patients diagnosed with autism and ADHD. So a lot of times when we see neurodiversity, people look at it as a psychological diagnosis, and it is. But a psychological diagnosis very often is what we call something that is a physiological problem that we don't understand yet. There are things that we just don't understand about why people's brains work differently, but pretty much there's almost always a physiological root. I work with families all over the world helping them try and figure out, okay, what does this child need to thrive? What are we missing? And the thing that I see with almost every single client, there may have been a couple that are just dyslexic with nothing else going on that did not show up this way, but even the dyslexic ones sometimes show up this way. Every single one of them shows signs of systemic inflammation. So systemic inflammation in children, some of the big things that I look for, copious amounts of earwax. Our ears make a lot more earwax when we have more inflammation. Another thing I look for is any kind of disruption in sleep, anxiety. That's how we're going to see it show up more behaviorally, because they don't feel good, so they're going to act a little differently. Another thing that we look for is constipation. A lot of times when we've got inflammation, there is some kind of difference with how the bowels are moving food through the system. And that's another big one. Let's see. Oh, also any kind of like eczema, itching, whether it's skin, hair, something like that. The skin is your largest organ. And a lot of neurodiverse kids have some kind of eczema that is inflammation. Like all of these things are inflammation. And very often when you get a neurodiverse kid, you're going to see signs of all of this in one kid. Also bleeding gums. That's another thing I look for too. Yes, sometimes if you aren't taking good care of your mouth, you might see some bleeding gums, but a lot of times it's a sign of inflammation. And if a child has multiple signs of this in multiple systems, it's not simply, well, you have an ear infection. This is something more systemic, because we're seeing this inflammation all over the body. And the sad thing is that most of the time people are so overwhelmed by the differences in behavior and communication that they never bother to ask or to look. And so nobody notices that the child has inflammation. Another concern is with Ehlers-Danlos, the connective tissue disease that I mentioned that we're learning so much more about these days. When you have Ehlers-Danlos, you have a significant amount of inflammation that gets trapped in the body. And I know a physical therapist who was able to do an autopsy on a woman who had Ehlers-Danlos. And he said that what was really striking to him when they did that autopsy was that as soon as they cut open the skin layer, the entire table was wet. And he said that was different from other autopsies he had done, because he said that with Ehlers-Danlos, so much inflammation is trapped between the skin that as soon as they opened up the skin, all of this inflammation was present under the skin. So there is a lot of inflammation that goes on with Ehlers-Danlos, because Ehlers-Danlos is a connective tissue disease. Your entire body is made up of connective tissue. So basically what I'm telling you is that the connective tissue that makes up my body is made wrong. It's not made the way it's supposed to. And so it doesn't work the way it's supposed to. That means that I have symptoms in all kinds of different systems that would seem to not make sense to most people. Well, why would you have this problem with your knee and then you'd also have this other problem over here and then be allergic to things? It makes people look like they're crazy because people think, well, that's not possible. We actually have a child in our area that me and my daughter know, and she was recently taken away by the state because they believe that she was being abused because she couldn't possibly have Ehlers-Danlos. But she sees the same doctor that my kids do, and they are not being believed. And so her grandparents lost custody of her because of not being believed. This is a huge problem. One of my doctors, I told them, I have Ehlers-Danlos. She found out what doctor had mentioned that diagnosis to me and said that, no, you don't, because she didn't respect that doctor. So I had to pay lots of money out of pocket to go see another doctor to convince her that I had it, because it was influencing my care. Another time I took my son to the orthopedist, And he was extremely rude to me for the only 15 minutes that I saw him, and accused me of trying to get my kids diagnosed with things they didn't have. And we had gone there to seek help. My son has pectus carinatum, where the chest grows outwards, and it may very well be linked to the Ehlers-Danlos. And I told him I was being treated and diagnosed with Ehlers-Danlos, and he's like, well, you don't want Ehlers-Danlos. I'm like, well, yeah, nobody wants it. On the bright side, I was able to advocate for myself, and I did not end up paying his bill, because I told them I can get people to insult me for free. I don't really need to pay you to insult me for free. So that was nice, but there are a lot of people that really struggle to advocate for themselves within a healthcare system. I'll be honest, I am more fortunate than most, because with my training and my background, I'm in a little bit better position to advocate for myself. But even I have tons of problems advocating for myself with my own doctors. If they don't know me well, I have a lot of trouble. I actually have a notebook that's this thick, and it's full of my medical records. And it goes with me to appointments, because I have learned that if I go in and I try to explain to a doctor what's going on with me, they will not hear me, not the way I intend for them to. But if I go in with a notebook full of my records, all of a sudden people stop and pay attention, because they realize that I've got something there. I've got data, I've got information, and I've got it pulled together and it's organized. And so that is one of the ways that I have managed to be able to advocate for myself. But Wycklife mentioned the anxiety of trying to get healthcare earlier, and that is a huge issue. I've had cancer almost twice. We caught it right as it was becoming cancer the second time. And whenever I have cancer, I am not in a good place to advocate for myself. I am not capable. I am so anxious at that point, because my first experience with cancer was rather traumatic. It was right after my daughter was born, so all my hormones were a complete wreck at the same time. And it was very difficult. And so anytime the word cancer comes up now with my health, I am not able to communicate as well. And I told my husband this last time, I said, look, the next time I have cancer, if I have cancer again, we are going to call a medical advocate, a patient advocate, because they can help you communicate with doctors. And that is one of the newest tools I've been hearing about here in the United States that I am really excited about. People that you can hire to help you navigate the healthcare system and to be your advocate. Sometimes there are times where we cannot communicate and advocate for ourselves because we are so overwhelmed, not only with our own feelings and the fear that most people have about trying to approach medical care, but we also have the secondary challenge of trying to do that with a brain that functions very differently from the way the system is set up. So those are some of the common issues that we see with neurodiverse healthcare. There are a lot. A lot of neurodiverse people do have genetic differences that cause these things. If you have small genetic differences, it can have a huge impact on how you metabolize things and how your body functions at a cellular level. So all of those things can have a big impact. There are other ways that we have health issues, but I would say by and large, the biggest issue that we see is inflammation. And if you see a patient who is neurodiverse, the first thing you need to look for is inflammation. because I guarantee you, you're probably going to find it. So.
Thank you, Amy. You're like a library. You've got a lot of information. As you shared this, I was imagining now for a child who does not have a parent like you, what do they need to do? What do they go through?
It is so
It means their
incredibly
life is
hard.
very difficult.
Yes, it really
And
is.
at some point you mentioned that you had to pay more money to get help. And it reminded me actually of a conference I attended, Dyslexia Rising Africa. And a parent said she has three autistic children, and everything all of a sudden is quite expensive. Even in the schools, she has to always pay more. And her conclusion of the matter got me thinking until now. She said, now the world thinks when you have special children, all of a sudden your income is multiplied by 3. You somehow have more money. You somehow have more money. Even the help you could get, even the house girl who can come and assist you always demands for more. Obviously, there's more work. So you reminded me this, and it's actually related to the question that I'm going to ask Wycklife. Wycklife, now your question reads like this. In many low resource settings, like rural setup, healthcare systems are already overwhelmed. How do we redesign care in a way that remains inclusive for neurodivergent individuals without creating models that only work in wealthy countries or in urban centers where there's a bit more income? Wycklife, will you take this one, please?
Yeah, thank you so much. So I want to start by saying that the most expensive thing in healthcare is not compassion, because compassion is always free. So when people think about redesigning healthcare, they often imagine expensive buildings, special clinics, advanced technology, and those valuable, but they do not, those are the not only things to improve in care for neurodiverse. So in many rural settings, if I can say, we may not need to have immediate access to very high special care because they are already not there and they are very expensive to bring. And if we say we want them right now, that is a lie. It's not going to happen. But again, if we have a progressive way of saying that we need this, then it will happen. So where do we start from? So we can start building healthcare that is respectful and inclusive, in my own view, that even if we don't have the resources, even if we don't have everything, but compassion is free, we can start from there. Even if we don't have everything in rural setup where people don't have information, stigma is real, then why don't we start it by improving the communication? So that why don't we start by training frontline healthcare workers to recognize those neurodevelopmental diseases in the rural setup? We can also improve that in our communications with the families in a way that we understand, where we don't stigmatize them, we don't label them. So we can reduce the unnecessary sensory stress where possible. Again, we can involve community health workers to identify and support those children early, something which does not require a lot of money and resources to start. So another thing I think we can do, and maybe Rotary and other organizations and the partners can come in, is we can find a way of partnering with schools and the community organizations, the rural setups, so that we support neurodiversity. So those changes, they always do not require a bigger budget, in my own view, but they require some commitment, and that we need to see every person as worthy and compassionate for care when it comes to rural. So innovation should not be measured only by how much money we spend or much money a country is wealthy, but it should be also measured on, by how we listen, adapt, and even respond to people's needs, because that is the major challenge. People are labeled, neurodivergents are labeled at the community and at the rural setups. Also, I think if we can have an inclusive healthcare, which should never have a privilege available for any wealthy countries, to me. That's how I see it. So, and most important thing is compassion, which is very free. That's all I wanted to say. But again, people will come by asking, I saw someone asking a question somewhere and I wrote it down that, so does acceptance means giving up? If those in the rural setup, then they accept, yes, they don't have the resources, but they have accepted. Does it mean giving up? To me, I think it is not so, because people communicate, learn, and reduce pain and improve mental health and live independently where possible. So acceptance is not the opportunity of growth, but acceptance means growth begins with dignity instead of shame. And if we give them that at the rural setup, where we give them the dignity and there is no shame, then it starts from there without even much resources. That is what I can advocate for today on that question you've asked. Thank you.
I'd like to jump on real quick on that and say that we've talked before, and it is so true. Our environments may look very different, but we still have the same basic problems. It is a need for compassion. And even if the way our healthcare looks or the way our lives look, even if those things are different, we still struggle with a lot of the same things. I know so many families in the US that are in financial debt trying to afford basic care for their children. It is a problem worldwide for families that have kids with some kind of a disability, whether it's neurodivergence, whatever it is. The problem is that anytime you serve a special population, it seems the price tag goes up at least 300%. And turns out the family's incomes are not going up 300%. So the problem is real and it is everywhere. It just looks a little bit different depending on where you are.
Thank you, Amy.
Yeah,
And I like
yes.
the fact that I have you from the US and I have Wycklife from Kenya. So we have both sides represented. And guess what? Wycklife, you just don't know. You just mentioned something that I never thought of. And it's actually, so when we are thinking of redesigning healthcare, we are mostly thinking, how will I change this whole facility? Yet it can be as cheap as just me changing my attitude. It can be as expensive as me trying to be compassionate. And by the way, Wycliffe, another point that you've left me thinking about is, not everything has to cost money. Like I ran dyslexia online school. Amy here has volunteered twice. A whole hour. She has shared her knowledge on my platform, and so many people have already learned about neurodivergence. So, and I didn't pay a single cent. I just asked Amy, could you volunteer? And she's facilitated twice. So it's not always everything that will cost us money. We can be compassionate. We can reduce the stigma and look at them as just like anybody else trying to navigate this world, So thank you so much, Wycliffe. And Amy, thank you for the additional, that compassion actually, it cuts across.
Yes.
It can apply in rural setup, it can apply in Rwanda, in Kenya, it can apply in the US.
And that compassion, that is why I work with parents now. I used to work in schools, but I realized that if you really want to make a difference for a child, support their parents. Because no one has a bigger impact on a child than their parents. And their parents may not have a lot of money to work with. They may not have a lot of resources. They may not have a lot of knowledge, but they've got a lot of heart. And if we can support them with that heart and get creative, okay, what do we have to work with? What could we do? What could we do to make things just a little bit better? Then that makes a huge difference. And it doesn't take, years of interest groups and committees and lots and lots of money to make a huge change.
Yeah.
Wow.
Actually,
Thank you, Amy,
supporting
for that
neurodiversity-
additional.
Supporting neurodiversity does not mean that those struggles don't exist. Yeah. They exist. So we are just acknowledging that the struggles are there and those struggles exist. And that's why we are going to be compassionate as we handle everything.
Thank you. Thank you, Wycklife. And actually, as we talk about collaborating, recently I got a project. We have discovered that people who use sign language, some children who have autism, they do not have speech. They're nonverbal. And the doctors, the healthcare professionals, they do not know sign language. So we are working on a project actually where we can train healthcare professionals on sign language, at least basic sign language, so that when a nonverbal person goes to see a doctor, they have some privacy. They can see a doctor and the doctor can at least understand some of the concerns without involving a third party. So indeed, and we can collaborate, and this can be a collaboration between schools, hospitals. It can be between non-government organizations like what we are doing at Dyslexia Tanzania to collaborate with the hospitals, with the government. We are actually now working on an MOU with the government to see how we can support each other. So thank you so much, Wycklife. That question is quite well tackled. Let me now pick your minds. Amy, we are having this question. We would like you to answer. If medical professionals want to help neurodivergent people live with neurodiversity well, what can they do? Let me repeat again, Amy. If medical professionals want to help neurodivergent people live with neurodiversity well, what can they do? Welcome, Amy.
Thank you. The first thing that they can do is it comes down to changing your attitude. Just what Wycklife was talking about, deepening a sense of compassion, but also being aware of our own biases. Being aware that just because someone comes off as sounding like they're crazy doesn't mean they're crazy. It could be that they have a health problem and they need help. And also, I would say get creative in how you can provide that care. One of the things that has been a wonderful asset to us since COVID is that now our doctor will do remote calls with us, which is wonderful because our doctor is two towns over. So it's a bit of a drive to get there. And also being in a doctor's waiting room sometimes can be very overwhelming because it's either too hot, it's too cold, there's too many people, it's too much noise, you're sitting still too long. Like there's all of these sensory issues that are difficult to accommodate for. And a very easy way of accommodating is to be able to provide remote communication. There's a lot of technology out there. I know a lot of my doctors are starting to use AI to take notes in my appointments, which I don't mind because quite honestly, I think that they sometimes probably take better notes than the doctors do when they're trying to talk to me at the same time. I can't take notes and talk at the same time. So I don't see how they could do it. But, we could also get creative with how we are using these new technologies. Maybe we could, have somebody who is in charge of communication with patients via text and use AI to help us. How can I say this in a way that will be understood by this person? Sometimes that could help us. And these are things that are readily available online for free. Things to help us improve our bedside care. We've got to start from the idea that the child and the parents and the adults are not crazy. That is not where we start. If you are in medicine, that is not your lane. That is the psychologist's lane. And if you think it's a concern, then you should refer out. But if someone comes to you and says, I feel bad, I need help, assume that they need help. I can't tell you how many children I have worked with who have been told, oh no, you don't have seizures. You have a neurological function disorder that keeps you from, it makes you think you're having seizures. And the child actually has a connective tissue disease that is comorbid with seizures a lot of times. I've seen this so many times. It is ridiculous. It's really, honestly, it's sad. Because so many kids do not get the care that they should. I have seen kids go from being relatively healthy looking kids that are walking to not being able to sit up on their own anymore because of the health care they received, because it was inappropriate. And some of this isn't just the medical profession. Some of this falls on the parents and the adults as well. We can do things to improve our own access to medical care. Like I said, one simple thing I did was just collect a notebook and organize it of my medical records. And because I'm not coming in with a folder full of messy papers and I'm coming in with a notebook that's organized, people go, oh, she knows what she's talking about. That makes a big difference. And that's something that I could have gotten help with from someone. I did it for my children. They each have their own notebook now that has all of their records in it, so that way they have a tool when they go into a doctor. We can also take a friend. I took a friend with me this last time when they thought I had breast cancer, and I didn't. They thought it 5 times, and they couldn't believe I didn't, because my body does weird stuff. And so it looks like one thing, and it never turns out to be the one thing they think it is. But she went in with me and worked to try and help communicate for me what was bothering me. And she was helpful. She was with me when the radiologist agreed not to do the MRI until I was on steroids. So that's another tool that can be used in our favor. But I would say, honestly, as far as the medical profession goes, the biggest thing is to listen and to recognize your patient as an equal partner. You don't know how their body feels. They do. Nobody knows their body like they do, because they live in it every single day. Yeah. And so if you can really see them and remember, this person is my partner, and they have things that they see that I'm not seeing. They have a piece to contribute, and respect that, and to have compassion for, what, they have something to contribute. They seem really anxious right now, but they still have something to contribute. How can I relieve that anxiety? What can I do to put them at ease? One thing that you could do is, when you're doing intake paperwork, there is a ton of questions that are asked in intake paperwork that I fill out. I can't tell you how many hundreds of pages I have filled out in the last 3 years. Include some questions about your preferences and communication and sensory processing. What kinds of things cause you more anxiety? What kinds of things are helpful when you're anxious to relieve anxiety? Collecting a little extra information on the front end might make a huge difference. How do you learn best? Is it best if it's written out for you? Is it best if, I give you an example? Those kinds of things can be very useful. And then also, I think really honestly, if you're going to look at it, it really all does come back to compassion.
Mm-hmm.
I
Mm-hmm.
think a lot of doctors are under a lot of stress. They have a lot of systems that they have to answer to. There's a lot of pressure. And then on top of that, they're also dealing with people who are not at their best because they don't feel good. And
Yeah.
so they are under a lot of pressure. And I know in the United States, we've got a lot of doctors under pressure because our insurance companies are kind of driving care now and telling doctors what they can and can't do and telling them you can only spend 15 minutes with a patient, which is just not enough if you have a patient that's neurodiverse. So I think that, you know, there is definitely an amount of pressure there, and I want to acknowledge that. But I think that we can still get creative. You know, maybe your office hires somebody because maybe you're in the United States and you only get 15 minutes for a patient. Maybe you train and hire somebody who is not, you know, medical and doesn't require as large of a paycheck maybe to just get to know the patient for a few minutes before you get in there and try to put them at ease. Somebody who's a good people person, has good natural people skills. They could collect some information for you on the front end. You know, a lot of times we will see, in the United States, I'll see nurses come into the room who will come and collect information. But, you know, again, that's somebody that you have to pay a decent amount of money because they have certain degrees and certifications. And they're also looking at it more from a medical model. I know there's some doctor's offices, my kids went to one, they had a therapy dog, which was kind of neat. They went above and beyond to try to find ways to make you comfortable. So if I was to sum it up in 2 words, I would say compassion and, well, I'm not sure if I can put this one in one word or not, but believe your patients. They are not necessarily crazy. That is not the assumption. They are probably highly intelligent.
Thank you so much, Amy. You're just amazing, you know. And you reminded me that, you know, when you were looking for one word you can sum it up, instead of saying believe in your parents and your patients, I thought of maybe take your patients as strategic partners, trying to sort out something together. They have a point to put on the table. They live in that body for as long as you can imagine.
You're
So
right.
thank you so much.
You're right. And you know what? When I work with parents, I tell people all the time, a lot of the parents that come to me, they say they've been to professionals where professionals basically think they're crazy. And whenever I get a parent, pretty much every single time, parents have knowledge. They know something. They might not have the right words to explain it. They might be attributing it to the wrong thing, but they know something. And
that's right.
It is on me to try to figure out how to listen to that parent and figure out what knowledge they have to share with me to partner with me to help their child have better long-term outcomes.
Thank you.
Right.
Thank you so much, Amy. You've answered it quite well. I'm sure you're emptying the questions for the audience. And we have quite a few minutes to go. We have very few minutes to go. So, and this has been quite an amazing session, Amy. You've answered it quite well. You've even added things that the patient should do. The question was, what can the health professionals do? You've added what a patient should do. Patients also need to know what they're suffering from. Like I love and I admire the fact that you have all your medical records together. So quickly, we have our last question for Wycklife. Wycklife tried to be a bit fast because our time is running out. So this last one is, it says, trust is central to healthcare outcomes. For neurodivergent individuals who have experienced misunderstanding, stigma, sensory overwhelm or dismissal within medical spaces. What practical changes must healthcare systems make immediately to become truly safe and accessible environments? A quick one, Wycklife.
Yeah, thank you so much. Number one, I believe trust is one of the most important medicine in healthcare, because you develop trust one-on-one with the patient before you do anything. And again, listening before making a diagnosis, because patients are not diagnoses. Diagnoses are labels, in my own view. So for you to make that trust, the patient need to understand and living beyond diagnosis, and living beyond autism. Yes, I have autism, but how do I live with autism? That is where we have dyslexia, yeah? But how do I live with dyslexia? So it's living beyond diagnosis, living beyond the label itself, that yes, this has just helped me to understand what I have. Now, how do I live? So that comes from trust. So when someone repeatedly feel dismissed in a way in an hostel, or misunderstood or judged, then they just avoid the hostel, just as I said before. They will avoid that hostel, and that effect will not only affect their health, but also their confidence in the whole system. So for me, I will say that let's begin by trust, and that will give us some actions to do. How do we bring that trust? It means listening without assuming these people. Let's listen to every patient. When you walk into the hospital, or when you are in the hospital, you're sitting there as a clinician, as a nurse, as a doctor, then don't assume them. It also means asking, how can that be of best support today? Can we be of best support to you? So you ask them, you ask the patient, you ask the neurodivergent, you ask whoever you're seeing the question how you can be of help. Then it also means you respect their communication style. Some are slow to speech, some are nonverbal, but that is their way of communication. So you have to respect every person's communication style. And it also means explaining all the procedures clearly. This is what we're going to do. This here and here and here, these are the procedures we are going to do. So at least they get to understand that, and the caregiver also understand that, okay, this is what we do, after this is what we do. So it's clear, a clear procedure for every person that will build the trust. And it also means recognizing the sensory environments, which affects ability of every person's care, especially in neurodivergent field. We have to recognize that sensory environment. It's very important for any neurodivergent individual. So most important, it means seeing the person before diagnosis, as I said before. And trust is not only built through the policies we were speaking before. Again, it is only alone that the policies can bring us the. So it is also built from the conversation of time to time, that one-on-one conversation. Yes, we have good policies. We are advocating for good policies. Fine, we have them right now. But does that alone help? Does that stop misjudgment? Does that stop stigma? No, it doesn't. So we also build the trust from one-to-one conversation in a way that it is respectful, and it's an interaction at that particular time, and it's show respect to that particular individual you are seeing at that particular moment. So neurodivergent people feel genuinely seen at that time, and heard and valued just like any other person. So dignity again becomes becomes not only more accessible, but also more effective for any other person. And we bring what is called patient-centered care, which was the previous session before we joined. So it is a patient-centered care which brings the trust. So that dignity is not only efficiency, and it becomes something, again, it will fall under compassionate again. You will have again to be more compassionate. So I would say that let the future generations, when the future generations look at us, they don't come in and say and remember us, they're saying, oh, we built good policies, we built good hospitals, smart hospitals alone. That is not going to be enough. But let them also see us as the generations that finally led them to see every person, led them to see every person with dignity, with hope, not as a diagnosis, and not as a burden to any other person. And again, not as a problem to be solved or to be fixed. Because neurodivergent are always seen as a problem to be solved or rather to be fixed, or as a disability as a whole. People feel like, this is a problem to be solved or to be fixed. So let the generations which are coming to see this differently, but more importantly, to see them as human whose life has equal value in the community. That is what I have to say.
Thank you so much, Wycklife. And you sounded like you're giving the conclusion of the discussion. And this is actually it. It brings us to the end of our panel discussion. But I'm going to read to you a small conclusion here because time is not on our side. We don't want to take time for the next panel, for the next session. So this is the conclusion of the discussion we've had so far. Redesigning healthcare is not a matter of charity or checking an accessibility box. It is a fundamental shift in human rights and systemic equity. The only way to truly achieve this redesign is to center on neurodiverse voices in every single decision. Tearing down a rigid one-size-fits-all model and building a healthcare system that is flexible enough to welcome every mind. The core shift is here. This approach heavily embraces the social model of disability, which suggests that a person is not disabled by their medical impairment alone, but rather by a society that fails to accommodate their differences. Health is the ultimate foundation of human potential, which explains why it sits firmly at the bottom of Maslow's hierarchy of needs as a critical physiological requirement. A person cannot learn, work, or thrive if their basic well-being is compromised. I want to thank you so much, Wycklife, for the amazing session we've had. Thank you so much, Amy. And a big thank you to Rotary Club of World Disability Advocacy for creating this platform that we can share with the whole world about how we can center on neurodiverse voices, even in the space of health. Thank you so much, everyone. And over to the hosts. We have spent our time very well, and I'm proud of my panelists.